Next is Dr. Shirin, free paper 79.
Good afternoon. I'm going to discuss on the therapeutic efficacy of online dichoptic digital program in anisometropic and emetropic amblyopia. Amblyopia is a visual developmental disorder consisting of reduced best corrected visual acuity in one or rarely in both eyes without the presence of any ocular pathology. Usually it is accompanied by binocular dysfunction including nil or impaired stereo acuity and interocular suppression. Why is treating amblyopia important? As already discussed, it causes binocular vision impairment, it causes fixation instability and abnormal binocular interactions. Also, it has a substantial impact on the visuomotor task, difficulty in playing sports in children, locomotor safety in adults, and also it may limit career option for the amblyopes. And the abnormal cortical changes produced in amblyopia, it can be reversed if prompt treatment is instituted. Usually we say during the critical period, it continues till the 7 years of age, but after this age also the cortical plasticity is decreased, but it is never lost. So we can, this is the basis of interest in treatment of the management of adult amblyopia. And the conventional measures of management of amblyopia used are glasses, patching. We can use atropine drops for penalization, and new approaches based on the binocular origin of amblyopia has received considerable research interest. Dichoptic training. Dichoptic training, in this each eye receives different stimulus separately and simultaneously, and to complete a task both eyes are forced to work together. Here contrast adjusted images are given. The better eye receives image with less contrast and the amblyopic eye receive image with strong contrast. Binocs is a cloud-based software using the dichoptic principle used for the diagnosis and management of amblyopia. It can also be used as a telehealth vision therapy program. Aim of our study was to evaluate the efficacy of dichoptic therapy in the management of refractive amblyopia, and the objective was to study the improvement in visual acuity after therapy and to study the improvement in binocular functions after therapy. Inclusion criteria: we included subjects with refractive amblyopia of age 6 to 25 years in whom other methods of treatment of amblyopia has failed, and the exclusion criteria were amblyopia due to other causes, previous intraocular surgery, developmental anomaly, developmental delay, high myopia, deviation more than 10 prisms. And we included 16 participants over a period of 6 months. It was an observational study done at Contrast Eye Hospital, Calicut. Detailed history examination was done. Best corrected visual acuity, cycloplegic refraction, prism bar cover test, stereopsis and binocular single vision were assessed and recorded. Foveal fixation was ensured, and before starting therapy we ensured that the participant get full cycloplegic correction, and if any deviation was present it was corrected with prism in spectacle less than 10 prism diopter. And our participants, the refractive error seen among our participants included compound hypermetropic and myopic astigmatism, simple hypermetropic, simple myopic astigmatism, and 3 of our participants needed prism in spectacles. Diagnostics can also be done with the Binocs software, and dichoptic therapy was done with Binocs Amblygo program. We gave sessions of training of 40 minutes daily, 5 days per week for 6 weeks. And that included a total of 30 sessions, and we used red green goggles for dissociation, and the games given were Super Ball, Superman, Supercar and Super B. Assessment was done at 2 weeks, 4 weeks and 6 weeks after starting therapy, and a follow-up was done at 3 months post-therapy. BCVS, stereopsis and binocular single vision were recorded. Results: out of 16 participants, 13 were in the pediatric age group, that is less than 12 years, and 3 were in the adult age group. 14 of them were having an isometropic amblyopia and 2 of them were having ametropic amblyopia. Regarding improvement in visual acuity, all of our participants showed improvement in visual acuity. The pre-therapy visual acuity was 0.346 logmar, and the post-therapy at 6 weeks it was 0.159 logmar, and it was maintained in 3 months. And the paired t-test show statistically significant improvement in visual acuity. And improvement in stereopsis, that there was a statistically significant improvement in stereopsis also, but in our study those participants who had nil stereopsis pre-therapy had no improvement in stereopsis post-therapy. It was assessed with the Wilcoxon-Saint rank test. And improvement in visual acuity was seen among pediatric and adult age group, and also among anisometropic and emetropic amblyopes. and improvement in visual acuity was seen among all types of refractive errors we included, and in those whom we used prism and those in whom do not use prism. And to conclude, dichoptic therapy with binocs is an evolving treatment in the management of refractive amblyopia. In our study, we got good results in both pediatric and adult age groups. So we have to recommend this to more patients with refractive amblyopia. Limitations were sample size of a study was small, and long-term follow-up after 3 months is not available to assess. And also, since the immediate treatment cost was high, many of the subjects were not willing due to financial problems, and many found it difficult to have a stable internet connection and a computer or laptop at home, as therapy has to be done online. Thank you.
Define amblyopia.
Amblyopia is a visual developmental disorder. Either it can be monocular or it can be present in one or both eyes without any organic cause.